Hi, I'm Donna Brown, and I'm going to be discussing Carl Rogers and his humanism, and also the cognitive behavioral therapy first thought out by or brought to us from Beck, um, and then how the two of those counseling theories can work together. Um, with Carl Rogers, he believed in the self-actualization, and in self-actualization, as that comes to us, and he talks about that, is all human beings have it innately to continue to grow and move forward and come to life. And that when somebody is out of balance or stuck, and their personal development hasn't gone, that's when we see them in the mental health system, or when they've come in for therapy. And our jobs as therapists is to help somebody develop that positive self-worth and the positive regard for themselves. With Carl Rogers, he believes more that it's a style, and it's something that you work within yourself, and helping the person develop and have that regard for themselves. So by developing empathy and showing empathy, and then you also becoming your true and valid authentic self, you then model that for the client in how to be able to be congruent and say, all right, well, this is how I feel, and have their feelings and their presentation match. Let's say that with somebody's self-image, and my image of myself and my image of what I want to be are two different, my ideal self and my image of who I am and how I feel about myself. When those are separate, then that's when you have a poor self-esteem. By helping them learn to become congruent, and those two pieces are overlapping, you're helping that person to become their fully functional self. So a lot of Carl Rogers' work was in developing and working with self-esteem and positive regard. You showing that unconditional positive regard for the client also shows the client how to develop and have that positive regard for themselves, and stop some of that negative thinking and that negative talk, and to develop a strong personality. There was work done by Russell and Cassell in, it was work done with some high school students, where they showed developing their self-esteem, their self-worth, and that positive regard in prevention from raising prison rates. The more that these at-risk youth, these at-risk high school students developed a stronger self-worth and began to self-actualize, it lowered their events and presentation of truancy. It also, they began to get jobs and became successful in life, which lowered then the prison rates. So next we're going to talk about the cognitive behavioral therapy. And cognitive behavioral therapy was first brought to us by Aaron Beck, and Aaron Beck's work was done in regards to depression, and her first works was with clients who were experiencing depression. Cognitive behavioral therapy goes, and it talks about what we think and do affects how we feel. And so with the role of the therapist is to take a situation and to look at how a person thinks about that situation, and how our thoughts relate to our behaviors and the sensations in our body, which then again goes to how you feel. And what Aaron Beck was, if we could change our thoughts, we can then change our behaviors, and that will reflect in how we feel. So Cognitive behavioral therapy can be used in many types of work, and it's been used with substance abuse treatment, it's been used for depression and anxiety, and the latest works has been helping somebody with psychosis and schizophrenia move away from the intensity of their symptoms and come into reality and do some reality testing and using the cognitive behavioral therapy. And that some of the main points with cognitive behavioral therapy is that it's if you have a learned behavior and you've learned a response, you can then relearn that response, and by changing your thinking, you're changing your behaviors, and you then again change how you feel about that situation. Also, with cognitive behavioral therapy, the therapist or the clinician is going to be helping to give a new skill set. So it's really a match of different therapeutic models kind of put together. You're using some of the desensitization, you're developing coping skills for anxieties, and even coping skills, say, in anxiety. And my old behavior towards that would have been to go out and use substances. And I just done some work with cocaine and cognitive behavioral therapy and developed a toolbox about cravings and urges. Those are time sensitive. Even with feelings, the seeking safety has been done, wrapped around with cognitive behavioral therapy. I get this feeling, I get this sensation, and that can only last for a time period. And if I can ride out that feeling, and they call it urge surfing, if I can ride out that feeling, then it's going to go away and I'm going to make it to the other end. And helping to develop some of the other tools besides urge surfing is maybe distraction, getting up and getting yourself busy, or developing a support system. Let me call somebody. These are all new behaviors that I have associated with this thought, so that then my end result is different, and then I have better feelings about me. Another piece with the cognitive behavioral therapy is learning the functional analysis, and how well does that old behavior function within my life, and pointing out this to the client. This is what I want for my life, but my behaviors aren't matching my goals, and helping the client to become congruent and work together towards their goal of whatever it is in their life that they want, and have their behaviors reflect in that. A big part of and how the two, cognitive behavioral therapy and humanism works together, is when the therapist or the clinician shows that unconditional positive regard and models and shows different behaviors for the person, then the person can then begin to pick up some of those behaviors. Also, in that unconditional positive regard with the cognitive behavioral therapy, is you're teaching and helping your clients to develop new thoughts and new beliefs about themselves. And by developing a stronger sense of who they are, then they're working on changing their thoughts and changing their thoughts about themselves. The two work really well together. They work together in either an individual therapy, and that's one of the reasons why I do like them, is because both therapies can be used individually and in group therapy, group setting. Both build a strong foundation for somebody for recovery. And when I say recovery, I don't just mean recovery from, let's say, depression. Recovery is a foundational saying, recovery from depression, recovery from substance use, and recovery in just building life. I want to move from one state in my life to the next state in life. Making sure that with the cognitive behavioral therapy, you are giving new tools, new things to replace, changing that negative thinking and then negative thoughts about themselves into positive thoughts, and then their behaviors change. And the reason why I chose the humanism and cognitive behavioral therapy, one is because both of them worked well together by enhancing how a person feels about themselves and treating them like a human being, helping to give them the skills to think of themselves as equal. That again, it raised their functional level in life. And also with the cognitive behavioral therapy, teaching somebody to learn how to think about themselves and think about situations differently, and then in response develop new behaviors that can give them, and giving them new coping skills gives them the ability to go and manage through life and become fully functional human beings, develop strong personalities. Both of them work good no matter what it is, the situation that you are trying to address. Is both types of therapy can help somebody move through and develop and begin to live a strong sense of themselves through life and have a functioning life.